Hey guys, I'm Laura from St. Louis Children's Hospital. Today we're at the Specialty Care Center here in the middle of West County, and we are going to talk about the Baby Kid Expo, which we're so excited to be sponsoring this year with our Washington University physicians. I'm here with Heather, the maker of all things Baby Expo. And so Heather, tell us a little bit about Expo and what parents can expect.
We are so excited to invite our St. Louis families out this Saturday to Queeny Park from 9 a.m. to 2 p.m. It's a free event where parents can connect with different businesses and services available in our area and just get connected to what's available in our area.
That's so great. So how many businesses are going to be at Baby Kid Expo?
We actually have over 70 businesses signed up, so you'll definitely want to come out and plan to spend some time there, and it's just a great place to get connected.
One of those 70s is St. Louis Children's
Yes,
Hospital.
they are.
We have a very nice footprint at Baby Kid Expo. We've got 5 different stations that you'll come to and visit, and we're going to talk with some of those experts that are actually going to be there on Saturday. Tell me a little bit more about the cost of Baby Kid Expo. Now, it's free.
Yes.
Do you have to get tickets in advance? How do I get my tickets? What do I do?
Exactly. Well, the event is free, but we are asking if you can pre-register. That would be wonderful. So you just visit our website, babykidexpo.com, pre-register on there, and then we'll also enter you for mini drawings for St. Louis tickets and different items. So it's worth doing for that anyway.
I think we could stop right there with free stuff, guys.
Yeah,
Come
exactly.
on.
Exactly.
And we will put a link to the registration in the comments after this video is done posting. So keep an eye out for that for sure. So, who all should come to Baby Kid Expo? Am I bringing my littles? Am I bringing my bigs? Am I leaving everybody at home? What should I do?
Definitely bring your kids. We have different things for all ages. We are going to have a petting zoo and pony rides. We also will have Mickey and Minnie Mouse on the main stage and mini princesses. Mad Science will be there doing a magic show, or doing a science experiment.
So totally kids.
Totally kids. We're going to have magic shows, comedy shows, and so you can check out our website for the full schedule of activities there.
Okay, and I would be bad if I did not remind everyone that the Baby Kid Expo is not happening at the Children's Specialty Care Center. It is happening at
Greensfelder Recreation Center at Queeny Park in Ballwin.
So do not come to the Specialty Care Center on Saturday. You will be horribly disappointed and very lost. So thank you so much, Heather.
Exactly. Thank
Anything else our family should know?
No, just pre-register. Take a look at what a good time is to come for the age of your kids, and we can't wait to see you on Saturday.
Sounds like that website is going to be key, and we will again put that in the comment section of this Facebook Live. Let's go talk to one of our experts who's going to be there on Saturday. Hi, Brittany.
Hi.
You look so casual, like you weren't expecting me at all.
No, what a surprise.
So this is Brittany, everybody, and she is one of our wonderful technicians over at our Safety Stop location. What is Safety Stop for somebody who doesn't know?
So Safety Stop is an education center, and it's what we do is we educate on car seat safety, helmet safety for bicycles. We do home safety, and we also do safe sleep education for parents.
So kiddos from A to Z are getting covered.
Yes,
in
any
Safety
kind of
Stop.
safety things for kids, we can cover.
Awesome. So at the Baby Kid Expo on Saturday, what are you going to be able to offer to parents and talk them through?
So what we can do on Saturday is tell you a little bit more about what Safety Stop is, talk to you about car seat questions you might have that we can answer for you, helmet questions, things about home safety or safe sleep, basically anything that you have a question about, we can address it there, and then if you need car seat checks, we can help you set up appointments and show you how to do that.
Oh, and I'd be remiss if I didn't throw this in there. How do you make an appointment at Safety Stop?
You have to call 454-KIDS and then press 3, and there's 4 different locations that we have where you can make appointments to come get your bicycle helmets checked as well as your car seats.
Okay, good deal. So we'll be sure to put that in the comments as well if anyone has any questions on Safety Stop. And also if you have questions as we're going through things, be sure to throw them out there. We're happy to help. So I see you brought a friend with you today.
Yes, I did.
So this is one of the things we'll be doing on Saturday is talking about helmet safety.
Yes.
And basically, how do you know if your kiddo's helmet's right?
Right, so we see a lot of kids wearing helmets the wrong way. Basically, when your helmet's on, we want to make sure it's covering that frontal part of their forehead there. So this line on their helmets needs to be parallel to the ground. What we see often is we see that their heads are kicked back and that you're seeing a lot of their forehead. If I can see more than 2 fingers of their forehead, it's not protecting what I need it to protect. These straps are really important as well. Not a lot of people pay attention to the side straps. We want these to come to like a V or a Y below the child's ears. This front strap really keeps keeps the front of the helmet on, and the back one makes sure that the back stays secure there, as well as under their chin. So under here, we want to make sure it's nice and snug. If you can get a finger under there, that's great, but if kids are slipping it off without unbuckling it, it's too loose, and if they are in a little bike accident, that's not going to protect their head.
It's not going to do anything.
Right.
I always see these, and my kids, I have a 5-year-old who likes his helmet, but he's always really scared I'm going to pinch
him. Yes, we
his
have the
little
pinch
skin.
guard pillow.
So there are helmets that come with that
Yes.
kind of stuff, because if it's not tight, like you're saying, it's not really doing its
Definitely.
job.
All of the helmets that we sell at Children's have these pinch guard pillows so that you're not pinching your child's neck every time you put it
Okay.
on.
And I hear you're giving away stuff at
We are.
More free stuff.
Yes, we are. We are giving things away.
So I think they're bike flashers.
Yes, little
so to go with
flashers.
the helmets. We're not giving away helmets at Baby Kid Expo, but they are always available at Children's Safety Stop.
And we can show you Baby Kid Expo how to get those helmets.
I love it.
Great.
I was looking at this on the back. I think about
Oh, yeah.
little girls and, well, even pulling your ponytail through, but what is that thing on the
So,
back when you were showing me that
There
earlier?
are these ratchets here, and basically it just tightens down so that it fits to your child's head perfectly. That's a lot of things we have parents say is, my child's helmet doesn't fit, like it's wobbly, it doesn't work. On helmets like these that we have at Children's, they ratchet down so that you can make sure it's that perfect snug fit on your child's head every time.
And that's keeping their forehead safe.
Yes.
And keeping that.
Yes,
the V's
wearing
where
bike
they're supposed to
helmets
go.
properly
Yeah.
help reduce the risk of brain injury by up to 75%.
Oh, wow. Well, I love it. Well, this is super helpful. Again, tell us how we make an appointment at Safety Stop.
All you have to do is call 454-KIDS and press 3, and they can give you a list of our 4 different locations and when we're open.
Very cool. So like I said earlier, Brittany is going to be one of our 5 experts at the Baby Kid Expo this Saturday. We're going to have several folks there, and we're going to visit with a couple more of them. Let's go. We're headed to see Kayla. Hi, Kayla.
How are you?
Good.
Good.
Kayla is one of our amazing child life specialists that are here at the Specialty Care Center as well as at Children's. Kayla, for those who don't know, what is a child life specialist?
So as a child life specialist, we help kids, all throughout the hospital, whether they're inpatient, outpatient. We help them kind of explain to them on their level, age appropriate, what's going on with them while they're in the hospital.
Awesome.
Yeah.
So when you're seeing these kids, do you have to make an appointment? Does the doctor pull you in? How do you guys kind of get hooked up with families?
Usually the nurses call us, or doctors if they think that a child can benefit from our services. They are usually good about calling us also.
So what happens when you get in the room?
So when we get in
Kayla's
the
arrived.
room,
Now
yeah.
what do we do?
So we are constantly assessing, what does this child appear to be scared of? Ask the child, what are you scared of? So then they're able to tell us, and then we kind of work through our minds, what would work best for this kid. We have distraction items if they're getting a procedure done, just to kind of help keep their mind off things, and then they can kind of forget about what actually is going on.
Yeah, so it's all about that distraction.
Yeah.
So I have to tell my personal story about child life and the amazing technique of distraction. So my 5-year-old took a spill, had a nice little laceration right in the corner of his head, pretty deep, so we decided to take him to the emergency department, and he was not having it, just very anxious, very confused, very overwhelming because there's so many people coming in and out, and as soon as they said the word stitches, he really lost it, and we're like, buddy, what's wrong, and the wonderful team members from Child Life came in because they could see he was having a lot of anxiety, and he's like, I don't want you to staple my face, and we were like,
What?
no one said anything about staples, but that's what he thought stitches were. And so Child Life was amazing when it came to, like, buddy, you can't even feel this. Like, they put a glove on his hand and let him actually feel his cut.
Yeah.
That he couldn't feel it, so he wasn't going to feel the stitches or the staples that he thought were going to close his face together.
Yeah.
And so then they were really great about, there was an iPad.
Yeah.
There were popsicles. Pretty much you can distract a 5-year-old with anything.
With anything, yeah.
So-
we have bubbles, we have lots of light spinners, lots of different things that the kids,
So all
have
different
touched
age
it.
groups
Yeah.
benefit from Child
Yeah.
Life.
So we go from itty bitty babies to, older teens that still get
That get
nervous.
nervous.
Yeah.
That get nervous. I think every parent can relate to that. Their kids get stressed out in different situations for different reasons.
And a lot of parents also, if they think that they can benefit, or their kid can benefit from our services, they also tell the doctor, hey, can you call Child Life? So we have a lot of doctors' offices here at the Specialty Care Center that call us up. So
there's a team here at Specialty Care
Yeah.
Center, and then there's a team over at the main hospital
Yep.
at Children's.
Yep.
And you all do different things,
Yeah.
focusing on different kiddos.
Yep. see all different areas also.
That's amazing. So what are you guys going to be doing on Saturday? No one's getting stitches on Saturday. No one needs to be distracted from that.
So on Saturday, if you come by our booth, we have some pill swallowing tip sheets. So that's nice. We help with that. We also have some of our distraction items like the light spinners, I Spy books, our VR goggles that are super popular right now,
Cool.
and then our iPad just to kind of scroll through and see what apps we have.
I never thought about VR goggles as something that would be such a good distraction. That, you know, if a kid sees that they have an IV being put in or something like that, or they're hurt and they can see it, it probably makes it feel a lot worse.
Yeah.
Like when parents make that horrible face when their
Like,
kids fall and then your kid reacts off of it. VR goggles don't even allow you to make the scary face.
So we have, you know, there's two types of kids. There's kids that like to watch what's going on, and there's kids that not. So it has to work for the perfect kid.
I would be the not.
Yeah. Yeah, so we use them a lot, and it works. So
That's so great.
It's
Oh,
awesome.
Kayla, thank you so much. We
welcome.
appreciate you being out there. I think you guys are probably going to be giving away stuff too.
Yes.
Again, free stuff on Saturday. So thank you so much. I'm going to kick it on over to Kendra, who's going to introduce you to a couple more of our experts.
Thank you, Laura. Well, I'm here now with Maggie Stark, and you said Stark like Tony Stark. And you know what? She has a superpower. She's a pharmacist, and that means she has answers about medicine. And as a new mom, I'm just like, hello, I have 10,000 questions. Let's get going.
Let's go.
So for starters, you know, every parent wants their kid to feel better, but medicine can be kind of scary territory. So for starters, when can you start giving your kids medicine? Like, when is Tylenol okay? When is ibuprofen okay?
Tylenol can be given to any child pretty much right after birth. Ibuprofen is something we worry more about though, because as your kidneys are still developing pretty much until the age of 6 months, so we get concerned with giving somebody ibuprofen at home if they're not under direct supervision of a physician.
And so often when I read like my boxes that says if your child is under the age of 12 months, you need to really consult your physician before giving them a dosage. How do you know what kind of a dosage to be giving your kid out?
We use a lot of drug references that help us determine based on a child's weight what would be an appropriate dose for them.
Okay, and I know that we have an app that we're working on that will allow parents to actually take a look at what kind of dosage they should be giving their child, and I believe we're going to be giving those flyers out at the Baby Kid Expo. So information is also along with the freebies, so parents pay attention. This might be a stop you want to make. So, okay. Now this one is from my own personal experience because I have a little girl that is on the nasty pink stuff right now, the amoxicillin. How do you know whenever it might be time to get your kid to the doctor and start talking about an antibiotic?
Anytime you would see a fever, it would be a good sign that you're looking at possibly an infection and not just a common cold. So that would generally be a sign for us that as a pharmacist, I would refer somebody to call in their pediatrician. In terms of the nasty pink stuff, we also offer some cool things to try and make sure we can get a child to take a medication. So both at Children's and here at CSCC, we have flavoring options. So we can flavor most medications that we give to a child just to help it taste better. We also go into other options for people that maybe can't afford the flavoring. It does have a small price associated with it, so it's $3, but we can also always make suggestions for other ways of flavoring to help get that medicine in.
And sometimes it's just yucky. It just tastes yucky. So what if the kid kind of spits it up a little bit? Do I need to give them more? Are they okay?
If a child spits up the medication within about 15 minutes, we generally recommend going ahead and giving a second dose. If it's been past about 15 minutes, we would generally assume that most of the medication has been absorbed and it's okay to not redose.
Okay, now I'm supposed to do this pink stuff with my daughter for 10 days. 2 times a day, 10 days. We really have to do all 10 days.
You do. So we have to make sure that that medication is in the body long enough to actually kill the entire infection. If your child starts to feel better and then they stop taking the medication, there's a chance that that infection could come back and even be worse than it was the first time.
Okay, and so tell me a little bit about what you're going to be doing this Saturday.
So this Saturday, I'll be able to answer any questions that you may have about your child's medications, any dosing questions related to my child or my grandchild is this age and this weight, what would be a recommended dose for them to have of Tylenol or ibuprofen or other over-the-counter medications. We can also talk about ways to dispose of your medication if you have stuff laying around at home that you no longer want anymore. And pretty much we'll also go through the other ways that we have at Children's available to dose medications. So outside of a regular retail pharmacy, our outpatient pharmacies offer medication syringes, adapter caps that are all designated and help making medication administration a lot easier.
So basically, you don't have to go to Google. There is no Dr. Google here. You're able to actually get some answers from a real professional and really kind of get to know you guys and what we can do for your children and how we can use medicine to help your kids feel better. So thank you so much. We'll look forward to seeing you on Saturday. All right, so we have one more stop to make. We're just going to head around the corner. Hi, Emily. This is Emily Hahn, and she is one of our dentists, our pediatric dentist, and I want you to know, look how nice she is. She is not a scary dentist at all, so you have no reason, parents and kids, no reason to feel fear this lovely lady right
Notice no white coat.
Pretty green, but I have to say, very pretty green. Okay, so, oh my goodness, we all know we have to brush teeth.
Yes.
We've got to do it. So, but when does my kid need to start doing it?
The first tooth. And that's where I think the confusion comes. Sometimes you actually want to use an actual toothbrush with your child from the very beginning. And the reason is you want them to be desensitized. You don't want them to have this foreign object coming at their mouth that isn't a spoon as soon as possible.
So tell me a little bit about how do you start with teeth brushing when you have a child that's, you know, maybe not even a year old yet, getting some teeth coming in?
Well, I have a prop who happens to be my own 9-month-old.
She has a very cute prop. Look at this little guy. Hi, buddy.
So Aiden, being a dentist child, has actually had his teeth brushed since his first tooth, which was 6 months. But there's a huge range when it comes to teeth. Some kids get their first teeth at as young as 3 months, and some kids are over a year, and that's okay. So the big thing is when you're using a toothbrush, you only want to use very little. And as you can see, he likes this a lot. Ready? You want to brush your teeth?
He's so lucky.
You brush your teeth? And so the thing is that you want to actually control the toothbrush. They like holding it themselves, but sometimes you have to hold their hand open and brush their teeth. Now he is a dentist child, so maybe he's a little bit more cooperative.
I was gonna say my daughter hates this, so
But
this is lucky.
He's just being very good. But he likes his toothbrush, so that's why the younger you do it, the better. But don't fear if your child is a little bit over a year old. The big thing is consistency. So the more often you do it, the more likely they are to do it. And it's good to affiliate it with something they're doing all the time already.
So I see that you have toothpaste right here.
Yes.
Is there a big difference between baby toothpaste, children's toothpaste, and adult toothpaste?
There is. So baby toothpaste, there's 2 different variations. There's fluoride and then fluoride free. So you're doing it. He's a little distracting.
All these things are happening.
So there's fluoride free and then there's fluoride containing. So most manufacturers actually distribute baby toothpaste as fluoride free. But in the past few years, the recommendation is to start with fluoride right away. And as you may have noticed, I only use a very, very, very little amount on my 9-month-old. So it's okay if they can't spit. You just want to get them that little bit of fluoride application from the get-go.
And when should you make that switch over to regular adult toothpaste?
When they're ready to not like the taste. So when you feel like their breath is really, really stinky, most kids think mint toothpaste is spicy. That's the first thing they describe it as, is spicy.
Okay.
And so using the kids' toothpaste, I mean, I have some 20-year-olds who come into we're still going to a pediatric dentist who use, you know, bubble gum or strawberry, and that's totally fine too. So honestly, whatever gets the kid to like brushing their teeth is what you should do.
And now when should parents start bringing their kids in to see you?
Also, first tooth or by the age of 1. And so it's not, the expectation isn't for your child to sit back and lean back in the chair and open their mouth like you're expected to.
Right.
You want them to develop a relationship with their dentist at that age, and so that you can get your questions answered as well.
Okay, that sounds good. And once again, not a scary thing, just to get you used to it.
Exactly.
So, and what are you going to be doing with us here on Saturday?
I'm here to answer those questions when you don't have a baby screaming at the dentist office. So if you have any questions about some teeth or any questions about products, I'm happy to answer them.
Awesome.
And we'll have toothbrushes.
All right, yeah, toothbrushes. Toothpaste or just toothbrush? Again, lots of great information, lots of great services are going to be on hand this Saturday. Lots of good information all in one place. Parents, of course, like we talked about earlier with your kids. Lots of fun stuff, petting zoos, visit from the princesses, which I have to say, I'm a big kid myself. I'm really excited about the princess. So once again, we want to remind you that it is this Saturday, that's August 11th, from 9 to noon. And forgive me, I have to make sure I have the place right. It's Greensfelder Recreation Complex at Queeny Park. and that is near Ballwin. And so we are looking forward. I'm getting a note that I'm saying it's 9 to 2. I'm sorry, 9 to 2. And again, we're going to put our Facebook event in the comment section. We're also going to have all that information there, and some of the resources that we talked about earlier. That's all going to be there. So one place. Feel free to keep dropping questions, dropping comments. We'll get to those. And thanks for joining us on Facebook Live. We're going to look forward to seeing you this Saturday.